Welcome. If you or someone you love is dealing with a diabetic wound, you already know how frustrating and honestly how scary it can be. So today, we're going to break down two really powerful oxygen therapies that could make all the difference in your healing journey. For anyone with type 2 diabetes, a foot wound that just won't go away is a huge challenge. That feeling of not knowing what's next is something so many people face, and that's exactly what we're going to tackle right now. We're going to put two very different approaches side by side. The one you might have heard of, hyperbaric oxygen therapy, or HBOT, and another one that's less known but really promising, called medical ozone therapy. Okay, so let's start with the challenge itself, because this is so much more than just a wound on your foot, right? It's really about what that wound means for your health and for your day-to-day life. The stakes here are incredibly high. The real goal is to find a path to healing that's practical, one that protects not just your limb, but your entire quality of life. So how can we actually tackle this? Let's meet the two oxygen-based solutions we're comparing today. They both use the power of oxygen, but you'll see they do it in surprisingly different ways. HBO is kind of the established player, the one you'll find in big hospitals. But ozone therapy is an emerging option with a totally different game plan. They both use oxygen, sure, but their strategies couldn't be more distinct. The easiest way to really get the difference between these two therapies is with a simple analogy that cuts right to the chase of how they work. This is the key difference right here. Think of it this way. HBOT is all about quantity. It's about physically forcing more oxygen into your tissues for a short time. Ozone therapy, on the other hand, is all about efficiency. It acts like a coach, teaching your body how to make better use of the oxygen that's already there, all day, every day. So with HBOT, you're literally inside a special chamber where the high pressure dissolves way more oxygen into your blood than normal. It creates this temporary, super oxygenated state to try and kickstart the healing process. Now, ozone works completely differently. It's less about force and more like a biological signal. That small, controlled dose of ozone essentially tells your cells to wake up and turn on their own healing machinery, improve circulation, and fight infection more effectively all by themselves. Okay, so that's how they're supposed to work. But what happens when we look at the actual clinical studies? What do the results for real patients tell us? The evidence for HBOT is pretty clear. It's a valuable tool. The research really backs it up as a limb-saving therapy, especially in those very difficult non-healing cases. And for those patients, that is a massive life-changing win. But here's the reality of that commitment. A key clinical trial for HBOT used a protocol of 40 sessions. 40. That means going to a hospital every single weekday for 8 straight weeks. That is a huge investment of your time, your energy, and your resources. So here's where things get really interesting with ozone. It seems to have this double effect. The studies show it helps heal the wound, yes, but it also works on the bigger picture. Things like improving your blood sugar control and calming down the body's chronic inflammation. And this chart, wow, it shows you just how big an impact that can have. In one major study, the results were just staggering. Patients who got ozone therapy had an amputation rate around 19%, but the group that just got standard care, they were at 57%. That is a world of difference. This is a really powerful quote from a major review of the evidence. It's suggesting that for some patients, ozone isn't just another option. It might actually be a more powerful and a more accessible one. And that brings us to what, let's be honest, often matters most to patients and their families, the day-to-day reality. We're talking about your time, your wallet, and how a treatment actually fits into your life. This table just breaks it all down so clearly. Take a look at the difference. For HBOT, you're looking at an hour and a half to 2 hours a session, 5 days a week in a hospital. For ozone, it's often a 15-minute session, just 2 or 3 times a week in a local clinic. That's a universe of difference for your schedule, your budget, and just your energy levels. And this quote just hits the nail on the head, doesn't it? Because a treatment is only as good as your ability to stick with it. The most amazing therapy on earth doesn't do a thing if you can't actually complete the course. So when does HBOT make the most sense? Well, think of it as the heavy artillery. It's a powerful tool for those really high-risk situations, advanced cases where other things have failed, especially when a patient can actually commit to that very demanding daily schedule. But on the other hand, ozone often makes more sense as a more flexible, patient-friendly option. It can be used earlier in the process, It helps with those underlying metabolic problems, and frankly, it's just way more accessible and realistic for a lot of people's lives. So, the big takeaway here is that your choices might not be just standard care or a grueling 2-month commitment to a hospital. Ozone really presents this third path, one that's practical, fits into real life, and supports your total health at the same time. And that really brings us to the final question, the one for you to think about. It's not just about closing a wound. It's about which strategy gives you the best chance to get healthier overall. And that is the crucial conversation to have with your healthcare provider, so you can find the absolute best path forward for you.